The National Institute for Communicable Diseases, the NICD, is the National Public Health Institute for South Africa. It provides reference microbiology, virology, epidemiology, surveillance and public health research to support the government's response to communicable diseases threats. We are going to take a look at what communicable diseases are, what causes them, and how they are transmitted. Communicable diseases, or most commonly known as infectious diseases, are diseases that can be spread from one person to another and can cause a large number of people to get sick. They are caused by germs like bacteria, viruses, fungi, parasites, or toxins. But how are communicable diseases spread? There are two ways communicable diseases can be spread: through direct contact or indirect contact.
Welcome, dear audience, to our episode 3. Today we'll be talking about communicable diseases that have affected many people here in Kenya and mostly in the world. I mean worldwide. That is it. So today we'll be talking about communicable diseases and of course their causes, their effects to those affected, and of course to the preventions, that is it. So today I am glad and I am honored to host the experts in our studio. So I am the host of today's episode. My name's Arido Jiro. Here is my co-host.
I'm Cynthia Chamwino.
Now guess.
I am Katana Anderson.
I'm Immaculate Odhiambo.
Welcome. Feel free. We are expecting a lot from you people. You are the experts. You are so you know a lot about these diseases of these communicable diseases. So we are expecting a lot from you people. Our audience out there are expecting a lot from you people.
Yeah.
So before I start, so what do we mean? What do I mean when I say communicable diseases? What do I mean? I mean, just let the audience know what is the meaning of communicable diseases.
First of all,
Yeah.
communicable diseases can mean those diseases that can be spread from one person, either from one person to another, from animals to a person, through various ways, either by water,
Yeah.
wind,
Yeah, or from animals to people to humans,
Yeah.
like the milk cow
All
to
right.
when consumed by human beings, and maybe the milk is contaminated with some pathogens, that is it. So audience, we just give us your attention. I mean, you will get something from us, and it will be of more value if you episode with us in this episode 3 podcast, that is it. So Anderson, you are Anderson, right? So
Yeah.
we have talked about the communicable diseases being those diseases being those diseases which can be spread through maybe through air,
Yeah.
So
Direct contact.
yeah. So can you just give us some examples of these diseases? Let us know. Yeah.
From now there are many examples of communicable diseases.
Just mention 2 of them.
But two of them, I think we can talk about the tuberculosis.
Yeah.
I think everybody is very much afraid with it.
Tuberculosis, yeah.
Yeah.
It's a bad
Yeah.
disease, it's killing people silently, yeah.
Yeah, we have the tuberculosis, and I think malaria is one of them, of the communicable diseases.
Malaria. So, what about the Immaculate? Can you just tell us the causes of these diseases, communicable diseases, commonly here in Kenya? How can they be spread from one person to another, or from animals to the humans? That is it. I mean, let us know. That is it.
Okay. First of all, we are going to talk about tuberculosis. Tuberculosis, mainly you can contact it through, let me say, a cough, right?
Yeah.
Let me say you have tuberculosis and I am not infected with tuberculosis. By the time you cough near me, There's an easy, that is a easy way in which I can contact that diseases. And also tuberculosis, let me say, I don't know if this is right, but let me just say, let me say when you are milking a cow, you know, then umechukua hiyo maziwa without kuchemsha, the way it is like that, there's a you can be affected by tuberculosis that way.
Or even meningitis, there is this disease which can be spread from milk cow to the humans, you know. Those unboiled milk
Exactly.
can cause meningitis in human. When the milk is consumed unboiled,
Unboiled milk.
Unboiled milk, that is it.
Okay, is it true that mtu mwenye ameafektiwa na tuberculosis akikof na mtu mwenye karibu na mwenye hajaafektiwa, hiyo ni ukweli, ana atapata that nini tuberculosis akikof, mtu mwenye ako nayo ataaffect mwenye hana weka karibu?
Okay, yeah.
Hiyo inakaa right.
Yeah, it is right, whereby this is a case whereby somebody cough without bila to prevent a cough, and they're coughing directly because if you have tuberculosis, you're supposed to cough this way or this way, but for this case we may cough to evil, dry cough to evil without kufunika mdomo, so that there's possibility there.
So
Kwa sababu mtu mwenye hiyo tuberculosis akikohoa, kuna hizo virus yenye ako nazo lazima so hapo lazima atakuambukiza.
So what is the measures wenye tunaambia watu wenye wameafektiwa na tuberculosis wafanye ndo wasiaffect hao wengine wenye
The measures, what I can tell some people who are suffering from tuberculosis, what they should do, let me say milk. Before taking a milk, you should first boil it. Boil, then you at least to kunywe. Then the second one, for those people who are coughing in public, you should at least use your
Preventive terms.
preventive.
Like you're covering your mouth.
You should cover your mouth. Yeah.
So when you just generalize your, measures on these communicable diseases, generalize those measures, that is it.
I think the measures that we are there to the communicable diseases is surveillance. Surveillance. Yeah. That is monitoring and tracking the spread of communicable diseases to identify the outbreaks and implement control the measures. Surveillance.
That's new term I've learned today.
So you have said, what is that surveillance? It's a measure of what?
Yeah, that's one of the measures.
Surveillance.
Yeah.
You have said it is
One monitoring and tracking the spread of communicable diseases. Yeah, to identify the outbreaks and implement control measures.
Control measures. That is it. Any other measure that you have?
Yeah, vaccination programs is one of the measures.
So the government must at least, start some, these programs of vaccinating people. Not only, nowadays government is only giving out its attention to the urban areas, and it intends to forget about those people in rural areas, So those people in rural areas will be suffering more because the government's attention is not in rural areas. So what can you tell the government about that? The government must at least start some programs at least it must start some programs of maybe conducting some vaccinations, not only in the urban areas, but also in the rural areas, Those people in the rural areas are suffering. And how the good health, the hygiene level in the rural areas is a bit low. So what can you at least tell the government to do to at least levelize its services?
First of all,
in both the rural areas and the urban areas,
yes.
In this issues of communicable diseases. That is it.
First, let's talk about in this local area.
Yeah,
As you are
rural.
as you are the host, and I think you have come in contact with many areas.
Yeah.
How have the communicable diseases affected that area? And from that, I think from the period of 2023 to now 2025,
Yeah.
are there any cases reported about people suffering from communicable diseases?
Yeah, especially malaria, you know. Yeah, people are suffering mostly with this disease called malaria.
Yeah.
You know, yeah, I mean, those people in rural areas, I mean, they are lacking the preventive measures like, you know, the mosquito nets.
Okay.
That is it, so yeah.
So, what the government should do,
Mm.
also those people are suffering from malaria. So let me talk first of the rural people, right?
Yeah,
Yeah.
yeah, yeah.
The government should provide nets to each sub-county.
Yeah. Mosquito nets and some, you know.
Yeah, and the government should also provide enough vaccination
Yeah.
and some
program.
drugs
Yeah.
for the patients
Yeah.
who might be at a time suffer from malaria.
At least the government should at least supply those vaccination equipment, vaccination medicines
Yeah.
to not only the urban hospitals,
But also to
to those health facilities in the rural areas.
and the government should also add the number of doctors,
Doctors,
and
clinical
nurses,
doctors, maybe.
because at times you can find that there are more than 200 people
Yeah.
who are
Patients.
suffering from malaria, but the number of doctors and nurses that are taking care of the patient is less.
And the
So
patient-
this might cause some patients who can die.
Yeah.
It might lead to death to some
That's what they
patients.
know.
So the government should employ some doctors to the hospital to reduce the number of people who lose their life.
Yeah.
Yeah.
Maybe the clinical officers, nurses,
Exactly, yeah.
doctors. So those services will be offered on the right time, at the right place, on the right manner. And so, of course, the death rates on these communicable diseases will be, I mean, it will reduce, you know. So now, we will now proceed to, you know, the statistics.
Yeah.
The statistics, the number of people who have died maybe because of this communicable disease here in Kenya, the number of people who have died, and of course those people, the number of people who are now suffering from these communicable diseases, you know. So there is information from the cabinet secretary of health, that is Aden Duale. So he was saying that at least 6 million suspected cases of malaria in maybe in 2024 to 2025
Yes.
have been reported here in Kenya. Not here in Kenya, not other countries, but in our country, Kenya. So it's a serious case. It's a big issue. It's a bigger issue, you know. It was carried out by Aden Duale. And you know, this number is only for the malaria patients. Yeah, it didn't mention other
Types of
communicable disease. He only
is
talked
only
about
malaria.
malaria.
Specific.
You know, yeah. So it's about 6 million
Yeah.
people who are for the malaria diseases here in Kenya.
That is a large number.
It's a bigger issue. It's a serious issue. 6 million malaria people only.
6
Yeah.
million are many people.
It's a big. So what do you think we have not done as a country for us to at least experience this number in only 2 years? It is only 2024, and we are not yet. We are 2024, 2025. Not only 2 years. We are
Even-
almost done with
yeah.
2025.
Even I've not
2 years
attended
only.
the Vision 2030.
Yeah,
And
6 million malaria people came in
yeah.
patients. So what's your take on that? Starting from Anderson.
Yeah. First of all, I think before the government giving out the nets to the local people or even the urban people, I think it is important to educate the mass. The mass
Raising the
getting
awareness on these
yeah,
communicable
it-
diseases, you know.
yeah,
that is it.
getting awareness. I think one of it is telling them to to clean their
to have the
environments.
hygienic
Yeah.
I mean to raise their hygienic level
Yeah.
to at least I mean into an at least level
Yeah.
hygiene, you know. Yeah, so
No, first of all is hygiene.
hygiene,
Yeah. Because the malaria, the habitats is I think stagnant water.
Waters, you know, yeah, maybe
No,
the
meaning the tuberculosis.
You mean
Yeah.
hygiene, mtu kama hakuna hygiene hapo, unajua kama hakuna usafi pia mosquitoes zinajaa
Kabisa.
nyingi.
Yeah.
So kitu yenye mnatuambia watu wanafaa kuwa na
Drainage stagnant water.
doing I mean those
mosquitoes sasa
Exactly.
Unajua pale nyumbani kama mazingira ni machafu, yani miti ambayo haijakuwa ikisafishwa, hiyo mazingira hayasafishwi, kuna vidimbwi vya maji, wale mosquitoes huwa wanataga mayai yao hapo.
you know the bird environment or you know those dumpy areas, you know.
Yeah.
Those dumpy areas are attracting the mosquitoes, you know.
Anopheles mosquitoes.
They can only, you know, they can attract 3 mosquitoes,
Yeah.
and of course those 3 mosquitoes can breed
Yeah.
into a bigger number of mosquitoes, and that is how the spread of malaria will be on a higher mode in a specific on those specific areas, you know, and especially in the rural areas. The hygienic level it's a bit low. Yeah, so we have talked about malaria. So there is malaria. Yeah, that is it. So you have said we have said we should the government, not only the government, of course the LCS and everyone. I mean the government. How can I put it? You know, the government council. The government should at least do something about this. You know.
Yeah.
This number should at least, you know. I mean, malaria only 6 million.
6 million
patients
how to
in
do
only
this?
2 years. What about, you know, by the time we'll be on the year maybe 2030, you know?
Yeah.
We will have lost many people on this malaria issue and on some on other maybe other communicable diseases, not only malaria.
Yeah.
So maybe any other thing that we can do as a country to at least reduce this number. You know, it's a bigger number of people. I have talked about the number of malaria patients here in Kenya being 6 million, and that is only the affected people, not the deaths. So the tuberculosis as per now is 1.3 million, and that is the number of adults who have the tuberculosis as per now. That is the government raised it as 1.3 million number of people who are having the tuberculosis here in Kenya. So tuberculosis,
Yeah.
1.3 million, 6 million. Those are these numbers are very big.
And the more mtu mzee akipatikana na tuberculosis huwa yuko hatarini sana.
Yeah, because the immunity is weak.
The immunity is it's a bit low, you know. So the chances of an adult or an aged person,
Yeah, surviving from
this
tuberculosis
is
very
very low, you know.
yeah.
Unaweza kutuambia importance of public health measures?
Importance ya public health measures, I think one of them ni your education.
That is it.
Education hiyo ambao tuseme unaita na wale watu wa mtaa, unawaambia how to deal with these issues, like hiyo kusafisha mazingira, hiyo kusafisha mazingira ili umbu wasiweze kubreed katika yale stagnant waters.
So I think as far as we have reached you, I mean we are done with our podcast. We have done a lot, you know. We have covered many things, you know. As far as the communicable diseases are concerned, we have at least covered many things, you know.
Yeah.
Thanks very much for your time. You are welcome. Feel free next time to at least visit us, you know, and you know, you will just give us some more education on these health issues here in Kenya and of course the other countries, you know. So we are done. Thanks very much for your time, people. It has been our pleasure to have you people as our guests, as our experts and everything of such kind of stuff, you know.
Yeah.
So audience, So, dear audience, we are done with our podcast. That's been our pleasure to have you people as our viewers, as our viewers, as our audience. So, thanks very much for your time. At least now you have learned more about these communicable diseases. Thanks very much, and at least now you know how to cope up with these diseases. So until next episode, just follow us on our YouTube channel. That is a Health Hyper Group. Like, subscribe, and everything will be good. That is it. Thanks very much. Thank you very much. That is it.
Bye.
Bye.